question which is coming almost everywhere in any exam, but they will change the question. The topic is same. Topic is same. The increase in the threshold of receptor when a series of stimuli of a subthreshold intensity are applied in a section is called as adaptation, accommodation, initiation, or resistance. What is the answer? If there is a continuous subthreshold stimulus, okay, it will not generate action potential. What is this called as, and what is the reason? Okay, I will tell you the reason. Reason is hyperkalemia. It is due to hyperkalemia. And what is this called as, anyone? Adaptation, accommodation, initiation, or resistance? What is your answer, doctor? Okay. Answer is accommodation. Now, this topic is very important. Let me brief this topic. You know RMP, resting membrane potential. What is RMP? It is the negative charge inside cell membrane. Negative charge inside cell membrane is called as resting membrane potential. Whenever I ask you, it is generated by, I've seen a lot of people are saying sodium potassium pump. That is absolutely wrong. It can be maintained by the pump, but it's generated by potassium efflux. It is generated by potassium efflux. So when potassium is going out, inside will be negative charge, and it is called as RMP. The first question they will ask you, RMP is generated by, answer will be potassium efflux. Or they will ask you, which ion is going to be responsible for resting membrane potential? Answer will be again potassium. So RMP is life. In physiology, what is life? Ability to respond. And this is only possible if we have RMP. And RMP is generated by sodium or potassium. Answer is potassium. That is why hyperkalemia and hypokalaemia both are very dangerous. Why? If there is hyperkalemia, again a separate MCQ, RMP will be less or more? RMP will decrease. Remember this point. If there is a hyperkalemia, if there is a more potassium in the blood, less potassium has to go out so that equilibrium can be maintained. So RMP will be less. Please remember this point. Hypokalemia. If there is a hypokalemia, RMP will be more. So hyperkalemia, RMP is less. Hypokalemia, RMP is more. This is a separate MCQ. Now, why I'm telling you adaptation or accommodation? This answer for this question is accommodation. But what is accommodation? And it is due to what? Hyperkalemia. So let me draw a simple diagram. You must be knowing every cell has a RMP and every cell has a threshold. Every cell has a RMP and every cell has a threshold. So what will happen in RMP and what will happen in threshold? Just a minute. So in hyperkalemia, what will happen? Suppose RMP is minus 90 millivolt and threshold is minus 70 millivolt. What will happen in hyperkalemia? In hyperkalemia, RMP will decrease. In hypokalemia, RMP will increase. This is hyperkalemia. This is hypokalemia. Suppose let me say hyperkalemia, RMP become minus 80 millivolt. In hypokalemia, it become minus 100 millivolt. So hyper and hypo both are dangerous. Both can stop the heart. But why hyperkalemia is causing accommodation? Listen carefully. If there is a hyperkalemia, RMP will go closer to the threshold and it will keep on stimulating the channel, and that will cause voltage gated sodium channel in the refractory stage. It will bring in the refractory stage, and doctors, this phenomena is called as accommodation. Accommodation, because they are very close now. So they are very close now, so they will damage the voltage gated sodium channel. Action potential will not come and heart cannot pump. It is called as accommodation. So whenever you get the word subthreshold for your exam, just remember one word. If there is a subthreshold, answer will be accommodation. If there is a suprathreshold, if there is a suprathreshold stimulus that will not allow action potential, then answer will be adaptation. So adaptation will be when there is suprathreshold, and accommodation will be when there is subthreshold stimulus. Okay, doctor?